Hello, everyone. My name is Solome Tibabu. I'm the host of Going Digital Behavioral Health Tech, and I'm really excited to have Dr. Kiki Sharif with us today from Doctors Under the Radar. Dr. Kiki, thank you for being with us.
Thank you for having me.
How about to get started, just a little background information about you, your organization for our audience.
Yeah, for sure. Hi, everybody. I'm Dr. Kiddis Sharif, Dr. Kiki for short. I am the founder and CEO of Doctors Under the Radar, which is a health tech startup looking to change the narrative and landscape for physician mental health. Through our innovative solutions, we look to increase resources, support, and access to physician mental health care. And we look to change the landscape in which physicians can communicate about their mental health issues. I am also the host and founder of the DocUR podcast, in which we have these candid conversations in which doctors tell their stories. And then you have subject matter experts giving their insight and information on how we can improve. And then I'm also the host and founder of the Physician Suicide Awareness Impact Summit, in which we just bring it all together every year during Suicide Awareness Month and on National Physician Suicide Awareness Day, September 17th, in which we just bring it to the larger stage so that the community and physicians and leaders can have these open conversations and create solutions, not just talk, but actually find solutions.
Amazing. And I see you have 12 jobs just like me. So how apropos that we're highlighting burnout today in this conversation, which has accelerated throughout COVID. But
Yes.
Yes, Dr. Kiki, why is provider burnout particularly important to you?
So long story, but I'm gonna make it short. I'm learning how to tell my story very short. I suffered from burnout and I suffered from mental health. And one of the biggest things I realized was I was not alone, but even finding a community, I also realized that there was a lot lacking in our community. I got hit by a car while riding my bike 3 days before medical school started. And I started with a sling on my arm and a boot on my leg, spent the weekend in the hospital. Long story short, I went through 6 years of my medical training without much of the resources, services, and support that I aim to provide for others. And it affected me. My mental health was bad, my physical, emotional, spiritual, everything, all the domains of health I suffered in. And one of the biggest push for this was that I had the friends, I had the family, I had the community. Not everybody has that luxury. And I became more vocal about it, but not everybody does that because our licensure, one, is on the line. If you disclose that you have mental impairment, there's no separation between illness and impairment. And that's a difference because impairment means you cannot function, while an illness means you can function as long as you're treating it properly. And a second issue is how will we be seen with our colleagues, right? I cannot be weak. This is a job which dependent upon our skills and our aptitude and our abilities. And then, of course, our patients. Who wants to have their patient look down on them because of mental health? And as we can see overall in all aspects of life, mental health is just now picking up as something we need to focus on. So people have the stigmas, they have the issues, they have, the stereotypes about mental health issues. And a lot of times, even especially in the Black community, it leads to a jail sentence or to extra things. So there's a lot of things that affect us, not only as physicians, but in our everyday lives, which makes it hard for us to express and need it. So I want to create the opportunities in which we can. And not to say you could do it because I did it, but better than me with better access and with better opportunities. So, yeah.
What about through the pandemic? Obviously that's made a big impact. What have you seen in terms of provider burnout with that?
So for providers, it's longer hours, for some less pay, a lot more work on the individual. There's more administrative tasks, less work-life balance. And not just that, but seeing death and despair every day, day in and day out, it does something to the human psyche. It does something to a human being. And we don't acknowledge that enough. I've come to learn that being a doctor, a provider, a clinician is a thankless job. and it's selfless. You give so much without anything really in return. And for the most part, no one really says thank you until it's like National Doctors Day or, something like that. But it's one of the statements I know growing up in a Jamaican family is reward sweetens labor. And there's positive reinforcement, if we want to say it in a psychological term. But when doctors are constantly berated and they don't have a lot of options for care, it exacerbates the issue. And COVID has brought to light everything doctors faced before and only worsened. And, even Forbes did an article recently where it's saying that by 2025, 75% of our clinician workforce will be done. And before that, we had a huge disparity where we're already having an issue with retention. And now COVID has only shortened that time span.
Wow. That's a huge problem, obviously. So now let me pivot a bit to tell us a little bit more about Doctors Under the Radar and the work you're doing there.
Yeah. So we actually just refined and defined our mission, purpose, and value. And our focus is basically to go into healthcare organizations or wherever there are doctors housed, and there's a huge population of doctors, and analyze and assess their environment and making sure that it's psychologically safe and making sure that there's policies, procedures, initiatives, programs dedicated to working with physicians and clinicians. But of course, you have to start with a target market. And because I'm a doctor, and based on the stats, my first niche market is the doctors. But our drive is not to put the onus on physicians, it's to target the healthcare leaders and help them see that their actions, their behaviors, their thoughts drives the culture and the environment in which physicians work. And physicians don't make the changes. They don't create the laws. They don't create the government. So there needs to be more done higher up so that the physicians can benefit. So we're doing the top-down approach where we're going directly to those that are going to make the decisions that can affect how physicians practice. And then we also have our tech piece in which we're going to use that data to create sustainable, evidence-based, data-driven solutions that's going to help out with being able to mitigate and anticipate burnout and physician suicide attempts. And then, of course, we have our media aspect in which I do public speaking engagements at workplaces, not just hospitals, anywhere where they want to increase mental health, transformational change management. And then we have the podcast, and then we have the summit. So, what our motto is basically where we combine media, communication, and data to transform healthcare.
That's amazing. It's scalable, and you're also out front, destigmatizing, accessing mental health care for providers. And you've talked about clinicians in the provider setting already out in the workforce, but what about medical schools and training? Is that, is this an issue in those communities too?
Oh, for sure. The data shows that depression starts from medical school. The stats are that medical students are more depressed than their aged peers. They start off at the same, but by the end of the first year, they are way more depressed, anxious, and stressed out. So our solution is not just for physicians that are practicing, but they're also for physicians in training. I understand the process. I understand the level of stress. We had exams every 2 weeks, and then we had assignments due. There's so much that goes on, and you're coming from a world where you could be top of the class, where you could be, I was honors, I was AP, and you get in and it's like, I failed. Wait, what? And there's no safety net. There's nothing. It's pick yourself back up. You got another exam in 2 weeks. So, overall, it's for anybody that needs help, because even on the side, I should add that I mentor medical students and residents, and I also work with other physicians in helping them understand the business aspect, because that's not something we're taught. So as you can see, it's not just for physicians. We are definitely multifaceted in which we want to ensure that from day one, doctors in training can get the help that they need, so that I'm big on prevention is better than cure. So if we can start preventative solutions from earlier on, then we won't have these stats later on in life.
Mm-hmm. Absolutely. So for organizations who are employing frontline workers at all levels, what are some specific points of advice that you could help them implement right now to make the workplace better for providers?
For sure. Create the atmosphere in which it's okay to state that you have something going on or you're experiencing burnout, or acknowledge that burnout is an issue. And not just by saying, oh, we have a chief wellness officer, or oh, there's EAP, but what initiatives do you have in place to engage your clinicians? What are you actually doing on a day-to-day basis that directly impacts them? Are they aware of what EAP has to offer? Are they aware of the opportunities they have for their mental health? We talk about work-life balance so much, but are you ensuring that administrative tasks are assessed properly? Is there a feedback system for when physicians have issues? There's many ways in which you can do it. And it's not easy for everybody because specialists and depending on the workload, but if we initially take an audit of what's going on and what is actually affecting each and every individual institution, I'm sure you will get feedback on what are some of the implementations that you can provide. But it starts with having the conversation. It starts with increasing your own knowledge and awareness of what's going on. So if I had to choose everything out of what I said, it would just be do an internal audit, talk to your doctors, get feedback on what their problems are, and that will drive your solution.
Right. Exactly. Just take the first step. And, not that this isn't even enough as it is to make the workplace better, to improve the physician mental health and well-being, but I'm sure there's plenty of data showing that that also impacts patient outcomes as well.
Yeah.
So even more reason. And how about for the providers who might be listening to this right now? What words of encouragement would you like to share with them?
Well, something I had to learn myself was you can't work from an empty cup. And no matter how much you want to do for someone else, and which we are trained to do, we are trained to take care of the patient first. You have to see yourself as the patient first. You're just as important, mind, body, and soul. And if you don't have the ability to work and function, they will find someone else to replace you. They will get the work done while you're still struggling and suffering. So if you could put in the work to prevent that, then it's easier said than done for sure. But if you can do that, take the steps. Understand that I actually found out during my research that a life in medicine is actually an occupational hazard. So when you look at it like that and you take it away from, oh, I'm weak, I'm sad, or no, like I failed, you have to put it in a perspective where we don't put the onus on ourselves so much when things go bad, but then we're collective when things go good. It has to be leveled across the board. So understand that it's okay to be weak. It's okay to have those days. You work 32 hours and then you're up again. You take a 5-minute nap and then you're up again. That's not normal for a human body. So if we understand that it's something bigger than us and not each of us individually, that will go a long way. And the last thing I would say is focus on self. Always do a self-assessment, a pulse check on yourself. Know your body, know your emotions, know how things are going, and don't be afraid to do that. A lot of times we feel selfish if we stop and take care of ourselves and devote so much time on ourselves. But I always think if you don't respect and love yourself enough, you can't expect anybody else to love and respect you. It starts with self, and it starts with you finding that wherewithal within yourself to say, I deserve it. I am enough. I'm good enough. I made it this far. And so no one can do what I do. And actually, this is the last thing. Have a tribe. have a tribe of people that will be real with you and tell you, listen, I had people tell me, yeah, you acting up right now, relax, or you're doing too much, or you're not doing enough. I always go with faith, family, and friends. Those are the three things that carried me through. Not everybody's going to have the ability to have that, but find those resources, support systems, and channels that will help you to develop a better a better sense of self, and opportunities for you to see beyond yourself.
Really powerful words of advice. And in today's changing workplace environment, a lot of providers are finding themselves switching over, contracting, or maybe even joining full-time virtual care providers completely. Anything to keep in mind as physicians and other types of providers are making that transition to becoming completely virtual care providers?
Well, human interaction is still important. And with medicine, it's not easy to say we will be 100% virtual. I am still strong on taking a direct look at a patient or being able to touch the patient and seeing what's going on. And there's a big push for it, but at the same time, is there accessibility for all patients to do that? So we also have to be mindful of those that are elderly, are young, are marginalized, and they don't have access to these services or the monetary opportunities to do that, and or the educational level. So, when it boils down to it, it turns out to be very, very lucrative. It's easier. It saves time because some doctors commute for hours. And it's a gift and a curse, but focusing on the gift, we can do a lot more with telehealth than we have even realized, because medicine is just now really stepping into the tech world. That is one thing I learned myself. We are far behind tech-wise in healthcare and medicine. And so there's a lot more that can be discovered and uncovered. But for what we have right now, I still feel that human connection is important. That touch when someone's crying, that hug when someone needs reassurance, that ability to look someone in the eye and say, I believe in you, or whatever. It's important. So as long as we don't lose that, and there's opportunities to have a mixture of both for the doctors and for the patients, I think we'll get far. Like, my business is virtual, but I can't lie to you. When I have those in-person meetings, I'm like so excited. Like, it's actually refreshing. There's moments where I can't be bothered and I'm happy that I'm online, but for sure, we need those moments where we actually sitting in front of someone or talking to someone.
So balance for both patients and providers is equally,
yeah.
Of course. So you talked a little bit about some of your solutions, including how can we measure the burnout levels of the workforce through technology that your company is developing. But as a provider, if I wanted to get involved in one of your events, or what could I expect?
Well, one of the things that I'm big on is my personal values is family. You come in and you get a vibe in which we're all working together. We're all striving for the same goal. We're all open and honest, and we have fun. I never start a meeting going straight to work. It's always, how are you? How's the family? How's life? So you get the ability to work with a company that values you as a person. And the beauty of being a startup is when you come in, your value add starts from day one. Your input, your insight means so much. You get to take charge. If you're the person that's like hands-on, by all means, you get to have input and say. If you're the type of person that's organized, listen, I am the person that does it. So if you're more organized than me, I will love you from day one. You get a company that is passionate, dedicated, and serious to what our mission and our vision is. You have a company that loves what we do. There was a moment in life where I hated being called a doctor. I hated medicine, but now I love the space that I'm in. So I try to ensure that others around me are in the same space as well for themselves. And also, you have a company that believes in personal and professional development. All my interns have their goals and objectives in which they desire from the company. And we work towards meeting those and reassessing them so that they within themselves are not just depending on us to give them experiences, but also what they can get from this experience. That was something I didn't leverage a lot when I was younger. I felt like they want me, yay, I got in, but I never really planned what I wanted from them. And in every experience, you're supposed to be able to say, this is what I got from it. This is not just what I was given. So my values are communication, authenticity, and family. And I hope and pray that that exudes through my company and through everything that we do. So you'll definitely feel like you're making a change and you're making an impact.
That's so great. Not only are you implementing the things that you're supporting other companies with within your own, but have been able to take personal challenges and do a lot of good with them. And so I'm fortunate to have the opportunity to do the same thing. So some final thoughts. What is your hope for the future of mental well-being, particularly for physicians and other clinicians? And what would you like to see in the coming years?
Yeah, so my hope is on a larger scale, mental health definitely gets the proper TLC that it deserves. Specifically for physicians and clinicians is one, we get more comfortable talking about it ourselves. We don't necessarily get much training on it, but we're taught to talk to people about it, and we're not all culturally sensitive enough to do that. So there's an understanding of the need to make it so that the environment itself is open to talk about it. And I learned that it's okay when you're mad and say, I'm going to kill you. No one gets upset. But the minute I say, I want to kill myself, it becomes like this whole thing in which, now I need intervention. To me, it's one and the same. So the same emphasis you put on one, you should put on both. And that we just need to have more conversations to destigmatize mental health and destigmatize suicide. We all go through depression, some more severe than others. We all go through a moment in which we're down, whether it's a level 1 or a level 10, we've all been there. And so we can all empathize and sympathize with others and lead with grace and compassion. That will make a huge difference as well. And just one other thing that I would love to see is just that we change the face of medicine in which doctors are seen as superheroes and they constantly have to wear that cape, which dehumanizes them and makes it harder for them to be true to themselves and have a vision in which they can live their lives in an authentic manner. Because when expectations are placed on you from day one, it's hard to overcome that. And the minute you step off, the minute you fail, in which we all fail in love, faith, life, spirituality, it doesn't matter. It's not the failure, it's how you pick yourself up. But especially in a cancer culture like we are in now, the failure means a lot more than how I succeed. So just having grace and compassion with each other and overall, and just making it where we have space to talk about it would go a long way.
Excellent. Thanks so much, Dr. Kiki. I couldn't thank you enough for your time and expertise with us today. And for all of the viewers, absolutely be sure to go check out Doctors Under the Radar. Thanks for your time.
Thank you. And thank you. I wish everybody the best.